So today I'll be talking about autism misconception. Most parents get confused when they get to hear that their child is autistic, and they started playing back, like, okay, to see, oh, where have I been wrong, what have I done, who and who is responsible for this, what are the mistakes that I should have avoided, and all like that. Parents has misconception that a baby that is autistic should show the sign very, very early years. That is not true sometimes. What are the signs that you would notice? Two things. The first one is regression, and the second one is altered progression. I would explain this, and then probably you might be able to see, okay, oh yes, this is true. Regression. Many children who have ASD actually have a normal developmental history in the first few years while they are growing up. They are happy, they are interactive, everything is actually on point for their appropriate age. Begin to lose this milestone as they grow up. Stop using few words that they are already using. They stop lose eye contact and social interaction. In this sense, you can say that the child is regressing. Sometimes when I have a encounter with some parents, they say, oh, when the child was 1 year plus, the child started saying tata, mama, water, and started imitating words that they've heard. And then when they get to a particular age, they just stop using all these things. They stop looking into people's eyes and all. At that point, you can say that the child is regressing. And now let's go to altered progression. In altered progression, sometimes a normal developmental growth does not regress. It is just like the way the word is altered. It just stops. Everything seems normal for a while. The child does not lost whatsoever they have achieved so far. All that just happened is that the child stopped at that particular age, and then this is very, very tricky to assess or probably diagnose or probably take notice of by the parent, because you still see the child say that mama, and do everything. When you start having problems or you start thinking about something is wrong is when the child clock another age and they are expected to meet up a particular milestone and they are not moving on from whatsoever they know. Their vocabulary does not increase, not their speech, and all like that. That's when it starts. You start getting to notice it as a parent. At that point, you can say that the child is experiencing altered progression. And then in this stage, you notice that their speech and their social interaction does not correlate with their respective age. At that time, you can say, oh, this child is experiencing an altered progression. As a parent, if you notice that your child talks, comprehend, play, interact, communicates like a baby, you notice that your child is not improving on the following after some months. What are these? Cognitive, speech and language, behavioral patterns, fine motor and gross motor skills, eye contact awareness, social interaction. Then I think you should know that it is time for you to get a medical assessment and get started with therapy session. If you just get your child report and you don't know how to move on from this stage, book a free consultation with me and let's talk so that we can know how to take this up from this level. And if you already have a child report and then you are looking for a therapy to help your child living with autism, kindly slide into my DM and let's have a discussion today. You're welcome.